Welcome to HTM Insider. I'm your host, Sherelle with Multi Medical Systems, and we're really excited to talk about right to repair again today. We have Ben Scoggins of Duke University, and I'd like to give Ben an opportunity to introduce himself and tell us how long he's been in the HTM industry. Hi,
Yeah.
Ben.
Yeah. Hey, how are you?
Good.
Um, yeah. So folks that know me have heard me say this before, but I'm 33 years old, and I feel like I've been in the industry for about 34 years. My dad was a clinical engineering original. One of the folks that was in it in the late 70s, early 80s. And I grew up around this stuff. I've been doing this professionally since 2011.
Well, let's start. Let's get down to it. Right to repair means a lot of things to a lot of people in a lot of different industries. But what does it mean to you, Ben?
It just really means that a consumer or the owner of a product has the right to perform their own repairs, or to choose a delegate to perform the repair, or just to have an option outside of whatever is offered only by the manufacturer. And that's, there's nuances and all that depending on the industry, but that really is just the bottom line.
So it's kind of interesting, since your dad has been, in clinical engineering for a long time, and you've progressed since a young age. So it's kind of interesting to get your opinion on, when did that change? When did ownership versus right to repair and the OEM, taking a stance on they're the only ones that can do it? Where did you see that shift happen?
Yeah, so an interesting story, because for me it actually started it started when I was right out of high school, and I worked on heavy equipment. And I was a field service tech for a distributor for an international just heavy equipment company. And one of my jobs, one of the primary things that I did was just troubleshoot stuff. And then you go to a huge, massive commercial lumber yard, or you go to a port or a place where these container loaders are, and they've got crews of very skilled, incredibly technical people working on their equipment. And yet me, as a 18-year-old 19-year-old that went to a manufacturer school for 3 months, they would call me in. I would get out my laptop, I would hook it up to a data port, I would pull a bunch of codes, I would look the codes up in my book, and I would say, here's the part you need to replace, here's my invoice, have a nice day. It didn't ever really strike me what I was involved in, and what I was doing, until 4 or 5 years later. I had gone to school, got an associate's degree, became a biomed tech, and I went and I got a laser certification, a certified laser repair tech, and I was working on a laser. And long story short, I put this power supply in. When I'm testing the laser, I'm not getting the power output that I need. So I called the manufacturer. I said, hey, you guys sold me a faulty board. I'm not getting the power output. And they said, well, you got to calibrate it. And I said, okay, well, what's the procedure? And they said, you can't do it. Only, you've got to have, the laptop and the special cord. And all of a sudden I thought back to the faces of those hundreds of people that stood there and watched me troubleshoot their crane or their container. And I thought, oh, I don't think they appreciated me at all. I think they probably felt like I feel right now. And I think prior to that, I was like most people, just you assume that the right to repair is kind of innate. You assume that it's just there. You don't think it's not a cause you see people lining up for, other than those of us that are privy and that are impacted. It's not something you're acutely aware of as a general consumer. So that's kind of my path to understanding what was going on here.
Well, when you look at it from now, we've been through COVID, where it has caused issues with technicians being restricted to travel,
Absolutely.
parts availability, equipment availability. How has it impacted you and your team in your day-to-day operations and patient care and patient safety?
Yeah, so it certainly has. So there's two parts to this, and I'll answer the direct question first. So me and my team, the very next thing that there was a shortage of after toilet paper was field service engineers coming on site. It was crazy, and it didn't matter what it was. I mean, if it was a patient lift or a linear accelerator, we were getting told that we're sorry, our organization's not allowing us to travel right now. Our organization is not allowing us into hospitals right now. It was such a disconnect from reality. And we had to get creative a couple of times with staffing to make sure that we had coverage. And our part of North Carolina was a part that struggled quite a bit, and we're a large, reputable hospital, and we ended up with a lot of really sick folks. And but my people were here. We were coming in and we were putting on scrubs and putting on our masks and social distancing, and we were still responding to service calls. We were still doing what we could. And when we needed that next layer of support, it wasn't available.
Right.
And it was disheartening. It was frustrating. And honestly, it was infuriating in a lot of cases, because I'm looking at, we're up here, we're all trying to figure it out. You're watching providers try to figure out how they're going to respond to a code, because it's the first one that's happened in in one of these rooms. And
right.
It was tough. And the supply, as far as like the supply chain piece too, that's at least more forgivable, because you understood the reality of, if just in time manufacturing and things like that, there's not just warehouses full of gaskets for my anesthesia machines. That does exist to some extent, but it's not months and months and months worth for everybody. And so at least that was a burden, and that was troubling, and you work your way through it. But the people that tell us otherwise, that we're not allowed to access service mode, and we're not allowed to turn off this PM light, we're not allowed to X, Y, and Z, when those folks are not coming on site, it was a completely different situation.
Yeah, I've heard that a lot, that it's been a frustrating time. Did you see any relax in those, like maybe service keys or help via Zoom or something, that they were trying to help you? Or was it just shut off? Were you just cut off from, too bad, it's broke, we'll get there when we get there?
So we definitely had some, I won't vendor name drop. I will say that I'm planning on another 35 or 40 years in this industry. And I have a very short list of people that anytime I'm ever asked, I'm going to say, they do not have your patients in mind, and let's move on. So there are a couple that just, we're so sorry, this is unfortunate, good luck, we'll see you, when herd immunity hits. And obviously it didn't get that bad, but there were some that worked with us, some that maybe extended gave additional licenses, some that maybe shared expert agreement type of contracts were expiring, and you have to re-up, but we weren't able to attend the school, they went ahead and extended. We did see a lot of that. So very appreciative to those vendors that remembered that what they're doing is providing solutions for patient care, and
Right.
and very very frustrated by some others.
Now, I've talked to a couple of people before you and on this podcast, Bensing Wang, Perry Kerwin, and a couple of things they brought up is, manufacturers are saying it's the IP, right? The intellectual property.
Sure.
That's why they're not giving it up. So if I was to give you a choice of the top 3 things, why do you think a manufacturer doesn't want to play ball necessarily, especially in this need? Would it be IP to you? Would it be money? What are some things that you can come up with?
One, I'll start with the popular one. One is that service is very profitable for vendors, whether ISOs, OEMs, all that kind of stuff. If it wasn't, they would do something else with their time and their resources, right? So you've got publicly traded companies and all these things. They're not providing service just out of the goodness of their heart. They're doing it to all kind of reasons, establish loyalty, build that kind of long-term relationship, selling sockets when it comes time for this thing to be replaced. You remember how great this lady or this guy was that came in and took care of you. But the margin, especially on like preventive maintenance, the margins are usually pretty beneficial for the vendors. And of course there's somebody screaming right now saying, yeah, we're only at 2%. Sure, but that ain't the standard. That's not the
Right.
the medical device service industry is like what, 20 billion dollars or something a year. I mean, it's serious money, and grows 8 to 10% every year. And but the second piece that folks aren't willing always to admit to, there is risk for the vendor letting us, letting people outside of their organization service things, especially when they're held so accountable by like the FDA. If there's a sentinel event with a device, that's a big deal. If there are multiple sentinel events with the device, we're reading about it in 24/7, and they're removing that thing. It's a problem, and it costs. These manufacturers spend, depending on what you read, 20, 30, 40 million bucks to get something through like the FDA process, and they just don't want people monkeying around with it.
Right.
Now the caveat to that is that ain't what we do. We're really good at fixing this stuff. And I know the techs that are doing these things are incredible, and they're very good.
And they're very focused on patient care.
Very
Right?
focused on patient care.
Such compassionate, dedicated people in the HTM industry. It's amazing.
Yeah. My dad used to tell me if I wanted to be a hero, I should be a firefighter. And
love it.
Yeah, and I always thought that was pretty good. So you definitely don't get into this for the money or the prestige or the recognition. It really is the folks that do it and do it well. It really does feel like a calling. But the piece that I do want to address, and may talk about this a little later too, though, but as an industry, we have to do a better job of representing ourselves, and we have to do a better job of representing ourselves outside of our organizations and outside of our symposiums. And when a manufacturer sends their government relations professionals to go meet and wine and dine the people that are making these decisions, writing these laws and these things, they spend less time talking about how awesome they are and more time talking about how we're scary. You should be concerned. Look at this, look at this work order, look at this scenario, look at this situation, this litigation, and almost always the evidence of those situations are documentation. As silly as it is, that's one of the things that we've got to do better, and the technicians and the management, and I really appreciate Matt and some of those folks that are doing an initiative right now towards just standardizing language. Because we don't, if you were running a HTM program and I'm running an HTM program and we're across the train tracks from each other, we can't even really compare our own data.
Right.
And so and I would bet pretty good money that both of us are doing an incredible job of keeping equipment up, keeping things compliant. Probably the Joint Commission or DNV or whoever was thrilled with their last survey, and yet we can't compare with each other how things are going.
Yeah, you're right. You're absolutely correct.
So
have you noticed any of these really affecting patient care? Do you feel like, had you been able to repair it or given the authorization or the key or maybe parts
Sure.
that you would have had better patient care in your facility?
Absolutely. Again, I said it earlier, I'm only 33 years old and can literally give you not anecdotal, personal stories of multiple times that I've been impacted. Not as a clinical engineering or HTM professional, but just as a patient or a patient's loved one. You know, I've taken a day off work to take someone to an appointment and found out that morning it needs to be rescheduled. And because I am in the know, I'll say, "Don't you guys have an HTM department?" And they say, "Yeah,
Yeah.
but this system that we use, it requires the OEM." And when I look at what it is, I'm like, "Oh yeah, I know exactly what that is." And you're right. So yeah, I mean, any patient care, it it's not like getting a haircut or whatever. And if I'm sorry, we can't do it this Wednesday, let's do it next Thursday. You don't know what that 8 days is feeling like. What if that 8 days is an 8 day extension of finding out if your breast cancer's come back? Or what if it's an extension of, you're supposed to have something done tomorrow, now it's next Tuesday. And that stuff's happening all the time. And I promise you it's happening as a direct result of the folks that are there every day clocking in, not having the autonomy to be able to go take care of whatever the device is. And not just that, but even just the cost of patient care. You know, we know that especially in the United States, our cost to health outcome ratio is not good. I'm dealing with a service contract earlier today with a 18% cost to service ratio and annually. So the device cost X, and every year I have to spend 18% of that for maintenance. You know, and that's not including, consumables and just like the rest of the operation cost. Yeah, I've got to pay for that, but guess what? My budget is underpinned to another budget that is underpinned to another budget that is paid for by billing people for our services. Maybe, and the bill, and it's billed to the payer. Okay, well, Medicare and Medicaid, when those costs go up, then the funding goes up. It's also Blue Cross Blue Shield, Cigna, Aetna, those people. When those costs go up, it all goes up.
Yep.
So it's people get hung up on kind of Medicare, Medicaid, and that's a big part of it. And but that's like, depending on where you are in the country, that's like half of it. There's a whole other half that there's a cost problem too. So
I feel for our rural hospitals, right?
absolutely.
I mean, your buying power and working with, Perry Kerwin, you guys have a lot more negotiations that you can bring to the table, right?
Certainly.
I see in rural hospitals, so many small hospitals had to shut down during COVID. They're run by facility directors who may call a third party in to handle their PMs, or they're trying to do it themselves and they just have service contracts. Now no one's coming out,
Right.
but they're the little guy, right?
Yeah,
And so people depend on these rural hospitals across the nation, and they're taking care of a lot of people that we don't realize. It's not just the big universities.
absolutely. Yeah, absolutely. And I'm glad you bring that up, because I was thinking through that as I was kind of thinking through us talking this afternoon, and honestly, the place I'm at now was um, uh, probably among the best places to be to deal with all this. And we had a ton of challenges. It was way harder than it should have been. But I really have thought a lot about, even my friends that are at larger places, but they work for ISOs. I've got a lot of friends in the industry that had no bargaining at all. I've got friends, people that I love dearly and think the world of, that have just been uh, removed from the ability to really make an impact.
So it seems to me that there's a lot of money being thrown on the OEM side. And I understand that there are things that they need to protect. We discussed those. But overall, the organization of the HTM industry has been difficult at best, right? Your BMETs are not the ones that are going out to talk to their legislators.
Right.
So it's now become a political issue. In California, it was just introduced and it went 10-0. So in favor of right to repair. Politically, how do you see it? Is it a bipartisan issue? Do you feel that in your territory in North Carolina that you're being heard? What are your thoughts?
Yeah, you know, po- politics have gotten so strange anyway. It's like there needs to be like a manual to understand which topic is it needs to be avoided and which crowds and things like that. It's wild that even something like the right to repair can be so polarizing just based on which person brings it forward into a legislator. I think you hit the nail on the head. One of the big issues is that folks like you and I have a lot more thoughts, but a lot less money to be able to go out and influence this stuff. We're approaching it ideologically, and I'm not sure that right now ideology wins in politics. And I think it's more about either being able to fund, at least at this level, it's more about being able to fund a decision or buy a decision, or it's just if it's not one of the really cool things to be doing right now, people just don't seem to care. And I think you brought up like California, and California is one of the places that actually explicitly mentions medical equipment. As one of the things that should be able to be repairable outside. And I think the last I looked, there's 25, 30, something like that, states that have brought forth legislation. And
yeah, there's 31 to be exact right now.
31. Okay, that's close enough. So 31, and most of them either they say like non-automotive or whatever, and many of them say like excluding medical and excluding agriculture. And you look, it's like, what? Okay, so why is automotive, agriculture, and what does the automotive industry, the agriculture industry, and the medical device industry have in common? They've got more lobbyists.
Yeah.
And again, and they're also heavily regulated industries, but is that like chicken or the egg type of situation?
Right. Well, how can you inspire our HTM industry out there to get more involved? What do you tell your team?
The first thing I usually tell my team is go get your PMs done. No, just kidding. Yeah, actually, I'm not kidding, but yeah, we have to represent ourselves really well every chance we get. Sometimes that chance is a patient got hurt and they're doing, they picked up a good TV lawyer and they're trying to get some money and they want to know every device that was on this patient. And now they're coming and they're subpoenaed all the service records for those devices. Let's make sure those service records are really good.
Yeah.
Like, and I tell my team this all the time, and I mean it sincerely. All you need to do is in writing, explain what you did. Mm-hmm. Because I know we did a good job. I know you did what you needed to do. And it's not about it's not about it's not a creative writing exercise or anything like that. It's just make sure if this is printed in a magazine, everyone that reads it would say, wow, Ben did a really good job on that work order. I don't know anything about PMing an anesthesia machine, but look at that test equipment he used. Look at those part numbers. Look at the test that he performed. He verified, at the end of all that, then he verified it was operating properly and he returned it to service and he talked to Rachel, or whatever. Yeah. And it's simple.
If you don't document it, it didn't happen.
Exactly. And I think that I think that it's got to start there. It doesn't, we have to, at every moment, every time we're subpoenaed, every time there's a tracer, every time the FDA comes in and wants to see what you did with the recall, every time anything like that happens, we should be just in some relatively consistent way across organizations, we should be able to show what we did. That way, when we're when Ben Singh and Matt Veritich, and when these folks are standing in front of the people making the decisions and saying, well, we are worthy of this, we're capable, they're not saying, yeah, but did you see this work order? And that feels like an oversimplification, but it's true. So I think we let the smart folks. I love Ben Singh and I love all those people. I really do. And let's make sure that we're representing ourselves in a way that it makes what they're doing even easier.
That's a great point, Ben. That really is. So I've enjoyed our talk today, and I'm going to ask you one last question.
All right.
All right. So we're closing everything in this series with, what is your wow word, your word of wisdom when it comes to right to repair? You might use a couple words, but give us something to think about from just you.
We do the big things so well. We have to focus on excellence and consistency on the small things that we're doing. And I think if we can handle that well, I believe that we are handed the right to repair on a silver platter, and we're able to move forward as an industry, and we can still compete with each other at RFPs, and we can still compete on KPIs and performance metrics and all this stuff, but we're doing that in a way that is who is the most excellent, and not trying to prove that the other person's not worthy.
I like those words, excellence and consistency. Pleasure having you on today. I hope I get to North Carolina to visit you in person someday soon.
Yeah, please do. I know a couple good barbecue spots, and yeah, I'd be happy to spend some time with you.
That'd be great, Ben. Well, thanks again. And thank you for tuning in to HTM Insider, brought to you by Ballpine Medical Systems.